I'm Dr. Michael Lawson, a practicing dentist at Greenfield Dental Clinic, where I've dedicated my career to preserving and enhancing smiles. Dentistry, to me, has always been more than just a profession. It is a blend of science, art, and human connection. Over the years, I've encountered countless patients, each with their own unique concerns and stories. Yet, among all the cases that have crossed my path, one patient's smile continues to haunt me. A mystery that challenges not only my clinical skills but also my understanding of the very nature of oral health. Greenfield Dental Clinic is where I've spent most of my professional life. It's a place that represents the forefront of modern dentistry, equipped with the latest technology, and staffed by a team deeply committed to patient care. From routine cleanings to complex restorative procedures, we strive to offer comprehensive services designed to meet every patient's needs. My passion for dentistry grew here, fueled by the clinic's supportive environment that encourages innovation and continuous learning. I've always believed that every smile tells a story, and it's my responsibility to listen closely and respond with empathy and expertise. Despite the many rewarding moments I've experienced, the case of Ms. Clara Evans stands apart. It arrived on an otherwise ordinary morning, quietly unsettling the rhythm of my daily routine. Clara was a woman in her early 30s, vibrant yet carrying a subtle tension that revealed more than her words ever could. She came to the clinic with a complaint that at first seemed straightforward but soon unfurled into something far more perplexing. A complaint that would test the limits of my training and patience. Her concern was unusual. Intermittent sharp pain coupled with strange changes in her smile's appearance. Clara described episodes where her usually confident smile would shift unexpectedly, sometimes seeming asymmetrical or distorted, accompanied by brief but intense discomfort. It was this combination of symptoms that immediately piqued my curiosity. A smile, after all, is not just a functional expression. It is a fundamental part of identity and communication. When something disrupts that, it often signals deeper underlying issues. The initial dental examination offered no clear answers. At first glance, Clara's oral health appeared unremarkable. No visible decay, no signs of gum disease, no structural abnormalities that could explain the pain or the changes in her smile. I meticulously checked for any dental causes. Cracked teeth, infections, bite misalignments, but every test returned inconclusive. This absence of obvious pathology only deepened the mystery. How could such pronounced symptoms exist without a clear dental origin? What struck me most was Clara's demeanor throughout the examination. She was patient and trusting, placing her confidence in my expertise despite the lack of immediate solutions. It reminded me that behind every clinical puzzle lies a person seeking relief, reassurance, and understanding. Her willingness to share her story, her discomfort, and her fears added a poignant human dimension to what initially seemed like a straightforward dental consultation. As I reflected on that first encounter, I realized that Clara's case was not just about teeth and gums. It was about the intricate interplay between oral structures, nerves, muscles, and emotions. It was a reminder that dentistry, while grounded in science, must also embrace the complexities of human experience. The smile we often take for granted is a dynamic and delicate expression, vulnerable to disruptions that may defy simple explanations. In the days that followed, I found myself revisiting Clara's symptoms, reviewing her examination results, and considering every possible cause within the dental realm. Yet the puzzle remained unsolved. I was reminded of the limits of our current knowledge and the importance of humility in clinical practice. Not every case fits neatly into established categories, and sometimes the challenge lies in acknowledging what we do not yet understand. This experience also reinforced my commitment to patient-centered care. Clara's case was a powerful lesson in listening, truly listening, not only to the symptoms but to the person behind them. It compelled me to approach dentistry with a blend of scientific rigor and compassionate curiosity, recognizing that each patient's journey is unique and deserving of thoughtful attention. As I prepared to delve deeper into Clara's case, I knew that the path ahead would require more than standard protocols. It would demand collaboration, innovation, and an openness to exploring uncharted territory in dental medicine. Her smile, uncertain and fragile, had become a call to action, a mystery that would shape my practice and challenge my understanding of the delicate balance between health and discomfort. The clinic, with its advanced technology and supportive team, provided the ideal setting for this journey. Here, we were equipped not only to treat but to investigate, to question, and to learn. Clara's arrival marked the beginning of an extraordinary chapter in my career, one that would test the boundaries of dental science and the resilience of the human spirit. In the quiet moments after Clara left the clinic that day, I found myself contemplating the profound role that dentistry plays in people's lives. Beyond the clinical procedures and technical expertise lies a deeper responsibility to safeguard the expressions that connect us, the smiles that convey joy, pain, hope, and identity. Clara's case was a stark reminder of this responsibility, urging me to look beyond the obvious and to embrace the uncertainties that sometimes accompany medical care. I have since carried that encounter with me, a constant reminder that even in a field as established as dentistry, mysteries persist. They challenge us to remain vigilant, compassionate, and ever curious. Clara's smile, elusive and enigmatic, continues to motivate me to push the boundaries of what we know and to approach every patient with the same dedication and care. As I prepared to engage further with Clara's case, I was aware that this was not just another dental consultation. It was the beginning of a journey into the unknown, one that would test my skills, my knowledge, and my resolve. It was a journey that reaffirmed why I chose this profession: to serve, to heal, and to seek understanding in the face of uncertainty. The story of Clara's smile had only just begun, and I was determined to follow it wherever it might lead, guided by the belief that every patient deserves answers, compassion, and hope, even when the path is unclear. Greenfield Dental Clinic stands as a beacon of modern dental care, a place where innovation meets compassion under one roof. Its sleek architecture, bright interiors, and state-of-the-art equipment embody the progress of dentistry in the 21st century. Stepping into the clinic each day, I am reminded of the remarkable advances that have transformed our ability to diagnose and treat oral conditions with precision and comfort. From digital radiography that minimizes exposure to radiation, to 3D imaging that reveals hidden complexities beneath the surface, the clinic is equipped to handle a vast spectrum of dental needs. The atmosphere here is more than just clinical. It's one of collaboration and continuous learning. Our team comprises hygienists, dental assistants, specialists, and administrative staff, all working seamlessly to create an environment where patients feel safe and cared for. This culture of support extends beyond patient interactions. It fuels my own professional growth. In this dynamic setting, I have the opportunity to refine my skills, stay abreast of emerging techniques, and engage with colleagues whose expertise spans the entire field of dentistry. It was within this environment that Clara's case began to unfold. The clinic's resources gave me confidence that, despite the unusual nature of her symptoms, we would find a way to unravel the mystery. Routine cases, from cavities to crowns, are managed here with efficiency and expertise, creating a rhythm that balances the everyday with the exceptional. Clara's arrival, however, signaled a departure from that routine, a challenge that would stretch the limits of our diagnostic capabilities and the clinic's multidisciplinary approach. The clinical setting itself played a crucial role in how I approached her symptoms. Having access to high-resolution digital X-rays allowed me to examine Clara's teeth and jawbone with remarkable clarity. Our advanced 3D cone beam computed tomography, CBCT, scanner provided detailed images of the craniofacial structures, offering insights that traditional radiographs might miss. These tools are invaluable in detecting subtle anomalies, fractures, or pathologies that could explain oral discomfort or changes in facial symmetry. Yet, despite employing every available technology, Clara's examinations yielded no definitive answers. This paradox, the presence of symptoms without visible cause, underscored the complexity of her presentation. It was a stark reminder that even the most sophisticated technology has its limitations, especially when faced with conditions that transcend conventional dental pathology. The clinic's supportive atmosphere was equally important during this period of uncertainty. Colleagues readily offered their perspectives, fostering a culture of open dialogue. Informal discussions over lunch, formal case reviews, and collaborative brainstorming sessions became part of the process. These interactions enriched my understanding and helped me consider alternative explanations outside the usual dental framework. The willingness to seek input from others and to question initial assumptions is a hallmark of the clinic's philosophy, a philosophy that prioritizes patient outcomes over professional ego. In addition to technological and collegial support, the clinic's emphasis on patient-centered care shaped my approach to Clara's case. We prioritize clear communication, ensuring that patients understand their conditions, the steps we are taking, and the uncertainties involved. Clara was kept informed at every stage, her concerns validated rather than dismissed. This transparency not only builds trust but also empowers patients to participate actively in their care, which is especially important when dealing with ambiguous or chronic symptoms. The environment also facilitates access to ancillary services that can complement dental care. Our connections with specialists in oral pathology, radiology, and even neurology provide a multidisciplinary safety net for complex cases. These relationships enhance our capacity to explore diagnoses beyond the oral cavity alone, recognizing that symptoms such as Clara's may have multifactorial origins. The clinic serves as a hub where such collaborations can be initiated swiftly and coordinated effectively. Reflecting on my time at Greenfield Dental Clinic before Clara's arrival, I recognize how integral this environment has been to my professional development. The blend of cutting-edge technology, a collaborative team, and a patient-focused ethos creates fertile ground for addressing both common and uncommon dental issues. It is a place where routine treatment meets intellectual challenge, where every case offers an opportunity for growth. This setting also highlights the contrast between predictable cases and those that defy easy diagnosis. Most patients come seeking solutions to familiar problems, cavities, gum disease, cosmetic concerns, and leave with their smiles restored and their confidence renewed. Clara's case disrupted this pattern, compelling me to step beyond textbook dentistry and engage with a more nuanced understanding of oral health. The clinic's infrastructure and culture provided the tools and support necessary to navigate this complexity without losing sight of the patient's humanity. The sense of community within the clinic proved vital during this time. The shared commitment to excellence and empathy fostered resilience amid uncertainty. It reminded me that while individual expertise is essential, the collective strength of a dedicated team can drive progress in ways that solitary effort cannot. Clara's case became a shared challenge, inspiring creative problem-solving and reinforcing the bonds among colleagues. Moreover, the clinic's commitment to continuing education ensured that I remained informed about emerging research and techniques that might one day illuminate cases like Clara's. Regular workshops, seminars, and access to professional journals keep us connected to the broader dental community and its evolving knowledge base. This culture of lifelong learning is crucial when confronting unusual or stubborn conditions, as it opens pathways to new hypotheses and interventions. As I reflect on the clinic's role in Clara's ongoing evaluation, I am struck by how environment shapes clinical practice. The physical tools, the intellectual atmosphere, and the human connections intertwine to create a framework within which complex cases can be approached with confidence and care. Without this nurturing setting, the challenges posed by Clara's symptoms might have felt insurmountable or isolating. The Greenfield Dental Clinic, with its blend of modern technology and compassionate teamwork, stands as a microcosm of what dentistry strives to be, an evolving discipline dedicated to healing, understanding, and human connection. It was here that Clara's enigmatic smile first came into focus, not just as a dental problem, but as a clinical puzzle demanding all the resources and empathy we could muster. In this environment, I found both the support and the impetus to push beyond routine protocols. Clara's case was a reminder that even in a field grounded in science and precision, we must remain open to uncertainty, ambiguity, and the unexpected. The clinic's comprehensive approach positioned us to confront these challenges head-on, blending technology, expertise, and compassion in the service of a patient whose smile held secrets yet to be uncovered. As I prepared to advance Clara's diagnostic journey, I did so with the reassurance that I was not alone. Greenfield Dental Clinic offered a foundation of knowledge, collaboration, and care, an environment uniquely suited to the demands of a case that was anything but ordinary. It was within these walls that the next steps of Clara's story would unfold, shaped by the dedication of a team committed to uncovering the truths hidden beneath the surface of a smile. Ms. Clara Evans first came through the doors of Greenfield Dental Clinic on a crisp autumn morning, her presence quietly commanding my attention. She was in her early 30s, with an air of composure that masked the unease she carried beneath the surface. Clara's story began with a complaint that, though seemingly simple on the surface, soon revealed layers of complexity that would challenge every aspect of my clinical expertise. When Clara sat in the dental chair, she described her symptoms with a mixture of clarity and hesitation. Her primary concern was intermittent sharp pain localized around her jaw and mouth, episodes that struck unpredictably and left her momentarily breathless. Accompanying this discomfort were unusual changes in her smile's appearance, subtle shifts that made her expression look asymmetrical or fleetingly distorted. These alterations were not constant but came and went, leaving her anxious and searching for answers. As a dentist, I am accustomed to hearing patients describe discomfort, often linked to identifiable dental issues such as cavities, gum irritation, or temporomandibular joint (TMJ) disorders. Yet, Clara's description didn't align neatly with these common patterns. The pain was sharp and sudden, not the dull ache typical of many dental conditions, and the changes in her smile suggested some form of muscular or neurological involvement. Her narrative was compelling and urgent, yet frustratingly elusive in its clinical implications. The initial examination was thorough and methodical. I started with a visual inspection, looking for any signs of swelling, inflammation, or visible abnormalities in the teeth, gums, and soft tissues. Clara's oral cavity appeared healthy and well-maintained. No lesions, no discoloration, no signs of trauma. I palpated the muscles surrounding her jaw, seeking tenderness or asymmetry, but found nothing definitive. Her bite was well-aligned, and the temporomandibular joints moved smoothly without clicking or pain. Next, I conducted sensitivity tests to evaluate the response of her teeth to stimuli such as cold, heat, and pressure. These tests are standard practice when patients report unexplained oral pain, helping to identify nerve involvement or dental pulp issues. Clara's teeth responded normally, showing no signs of hypersensitivity or nerve distress. I then proceeded with digital radiographs and panoramic imaging to rule out hidden fractures, impacted teeth, or other structural anomalies. Again, the results were unremarkable. Despite the comprehensive nature of the examination, no obvious cause emerged to explain Clara's symptoms. This absence of tangible findings only intensified the sense of mystery surrounding her case. I was acutely aware that her pain and changes in facial expression were real and impactful, even if they defied conventional diagnostic criteria. It was a humbling reminder that clinical presentations do not always yield to immediate explanation. Throughout the appointment, Clara's demeanor was both patient and anxious. She expressed relief at being heard, but also frustration at the uncertainty that lingered. Her story was interwoven with moments of hope and disappointment, a reflection of the emotional toll that chronic, unexplained symptoms can exact. The smile, she confided, was more than a physical gesture. It was a vital part of how she connected with others and expressed herself. The unpredictable alterations in her expression left her feeling vulnerable and self-conscious. As I documented her symptoms and clinical findings, I felt the weight of responsibility not to dismiss or minimize her experience. It was clear that a straightforward dental diagnosis was unlikely. Instead, I sensed that Clara's condition might involve more intricate interactions between dental structures, muscles, and nerves, perhaps even factors extending beyond the oral cavity itself. This recognition prompted me to consider a broader investigative approach. The challenge lay not only in the complexity of her symptoms but also in the limitations of our diagnostic tools. While technology provides remarkable insights into structural abnormalities, it is less adept at capturing dynamic or functional disturbances that fluctuate over time. Clara's intermittent symptoms made it difficult to observe or measure the changes directly during clinical visits. This unpredictability added another layer of difficulty in constructing a coherent clinical picture. Yet, Clara's case also underscored the importance of listening deeply and valuing the patient's narrative. Her detailed descriptions of symptom onset, duration, and triggers offered clues that could guide further inquiry. The story she shared was as vital as any imaging or test result, reminding me that effective diagnosis often begins with attentive listening. Her willingness to trust my expertise, despite the uncertainty, strengthened our therapeutic alliance and motivated me to pursue answers relentlessly. In the days following her visit, I reflected on the limitations of a purely dental perspective in addressing Clara's symptoms. The complexity suggested involvement of neuromuscular pathways or possibly even psychological factors influencing the presentation. I realized that a multidisciplinary approach would be essential to unravel the intertwined threads of her condition. This insight marked a turning point, shifting my role from sole diagnostician to coordinator of a broader team of specialists. Clara's case also brought into sharp focus the emotional dimensions of oral health. The smile is a powerful symbol of identity, confidence, and social connection. When it becomes unpredictable or painful, the impact reverberates beyond physical discomfort, touching on self-esteem and quality of life. Understanding this holistic dimension reinforced my commitment to compassionate care, recognizing that healing extends beyond resolving symptoms to restoring a sense of wholeness. Throughout this process, Clara remained engaged and hopeful, embodying resilience in the face of uncertainty. Her trust in the care team and her openness about her fears created a foundation for ongoing collaboration. This human connection was a source of strength amid the clinical ambiguity, reminding me that the patient's experience is at the heart of every medical journey. As I prepared to delve deeper into Clara's case, I knew that conventional dental assessments alone would not suffice. The next steps would require expanding the diagnostic lens to incorporate perspectives from oral pathology, neurology, and possibly psychology. This willingness to look beyond the obvious and to embrace complexity was essential in addressing a case that defied easy classification. Clara's arrival at Greenfield Dental Clinic marked the beginning of an extraordinary diagnostic challenge. Her symptoms, intermittent sharp pain and elusive changes in her smile, presented a puzzle that demanded both technical skill and empathetic insight. The journey ahead would test the boundaries of dental knowledge and the resilience of patient-practitioner partnership. In that initial encounter, what began as a routine consultation evolved into a profound exploration of the interconnectedness of anatomy, function, and emotion. Clara's case was a vivid reminder that every patient brings a unique story, sometimes one that resists straightforward answers but nonetheless deserves unwavering dedication and care. As I looked ahead, I was resolved to pursue every avenue to uncover the cause of her symptoms, guided by the conviction that behind every puzzling presentation lies the potential for understanding and healing. Clara's smile, fragile yet determined, had already begun to reshape my approach to dentistry, transforming it into a quest not just for diagnosis but for connection and hope. In the days following Clara Evans's initial visit, my focus shifted to unraveling the enigma of her intermittent pain and the unusual changes in her smile. The complexity of her symptoms demanded a meticulous and systematic diagnostic approach, one that extended beyond the routine clinical examinations I had already performed. I was determined to leave no stone unturned in my efforts to identify the source of her discomfort and the underlying cause of her shifting expressions. The first step involved revisiting the fundamental diagnostic tools available within our dental practice, ensuring that every possible dental origin was thoroughly explored. I scheduled a series of advanced imaging studies, starting with panoramic radiographs to provide a comprehensive view of Clara's entire dentition and jaw structures. This was complemented by high-resolution periapical X-rays to examine specific teeth and surrounding bone in greater detail. Despite this thorough imaging, the results remained inconclusive. No fractures, lesions, or pathologies emerged that could explain her symptoms. To further investigate, I employed three-dimensional imaging using our cone beam computed tomography (CBCT) scanner. This technology offers unparalleled detail of the craniofacial anatomy, allowing visualization of bone, teeth, and soft tissues in multiple planes. I hoped that this advanced imaging might reveal subtle anomalies or hidden defects that traditional X-rays could miss. Yet, even with this enhanced perspective, Clara's scans showed no abnormalities. Her jawbone, temporomandibular joints, and dental roots appeared structurally sound and symmetrical. Recognizing that structural imaging alone might not capture functional disturbances, I turned to a battery of sensitivity and neurosensory tests aimed at assessing the integrity of her oral nerves. These included thermal sensitivity tests, where cold and heat stimuli were applied to teeth and soft tissues to evaluate nerve response. Additionally, tactile sensation was assessed using light touch and pinprick stimuli to detect any hypoesthesia or hyperesthesia suggestive of nerve dysfunction. Clara's responses were within normal limits, providing no evidence of neuropathy or altered nerve conduction. To evaluate muscle function, I performed electromyography (EMG) studies of the masticatory muscles. This technique measures the electrical activity of muscles during rest and movement, helping to identify abnormal muscle contractions or spasms that might contribute to changes in facial expression or pain. Once again, the EMG results were unremarkable, showing normal muscle function without signs of myopathy or neuromuscular disorders. Throughout this investigative phase, Clara's symptoms persisted unpredictably. The intermittent nature of her pain and smile changes complicated the diagnostic process, as they were difficult to capture during clinical visits or tests. I encouraged Clara to maintain a detailed symptom diary, noting the timing, intensity, and possible triggers of her episodes. This record became a critical tool, offering insights into patterns that might otherwise go unnoticed. Despite the extensive testing and careful monitoring, the complexity of Clara's case deepened. Each diagnostic modality seemed to eliminate potential causes, yet the symptoms remained unresolved. It was a paradox: symptoms real and distressing, tests repeatedly normal. This disconnect was both frustrating and humbling, highlighting the limitations of current dental diagnostic capabilities when faced with such elusive presentations. At this juncture, I began to consider whether Clara's condition might transcend traditional dental pathology and involve systemic or neurological factors. The boundaries between disciplines are often blurred in cases where symptoms overlap multiple organ systems. This realization prompted me to expand the diagnostic net to include consultations with specialists outside of dentistry. Throughout this period, Clara's resilience was remarkable. She remained engaged and hopeful, despite the uncertainty and the absence of definitive answers. Her trust in my commitment to uncovering the truth was a source of motivation, reinforcing the importance of perseverance in the face of mystery. I felt a profound responsibility to honor that trust by exhausting every avenue of investigation. The diagnostic odyssey also underscored the necessity of a multidisciplinary approach in managing complex cases like Clara's. Collaborating with colleagues in oral pathology, neurology, and even psychology became essential to piece together the fragmented clues presented by her symptoms. Such collaboration not only broadens the scope of evaluation but also enriches clinical reasoning through diverse expertise. In parallel with the technical investigations, I remained attentive to the psychosocial dimensions of Clara's experience. Chronic pain and altered facial expression can profoundly impact mental well-being, contributing to anxiety, depression, or social withdrawal. I ensured that Clara had access to supportive counseling services, recognizing that addressing emotional health is integral to comprehensive patient care. Reflecting on the diagnostic challenge, I was reminded that medicine, including dentistry, often grapples with the unknown. Not every condition fits neatly into established categories, and some symptoms arise from complex interactions beyond simple anatomical defects. Clara's case was emblematic of this reality, an intricate puzzle demanding patience, creativity, and empathy. Throughout this process, I maintained open and honest communication with Clara, sharing updates, uncertainties, and plans for further evaluation. This transparency fortified our therapeutic alliance and empowered her to participate actively in her care. It also emphasized the importance of humility in practice, acknowledging what we do not yet understand while striving to learn more. As the investigation continued, I began to formulate hypotheses that might explain Clara's symptoms. One possibility was a rare neuromuscular disorder affecting the muscles responsible for facial expression, yet sparing other motor functions. Another was a subtle autoimmune process targeting oral tissues or nerves, with symptoms too mild or intermittent to detect on standard tests. Alternatively, functional neurological disorders, where symptoms arise without identifiable structural lesions, were considered. Each hypothesis carried implications for further testing and management, underscoring the need for specialized assessments and interdisciplinary collaboration. The complexity of Clara's presentation demanded a dynamic and flexible approach, adapting to new information as it emerged. In this phase of the diagnostic journey, the limitations of my dental training became apparent, but so did the strength of collaborative care. I reached out to neurologists and oral pathologists, sharing clinical findings and imaging results, and seeking their perspectives. These interactions enriched my understanding and opened new pathways for investigation. Clara's case also highlighted the evolving nature of dental science. While our tools have advanced remarkably, some conditions remain enigmatic, defying straightforward diagnosis. This reality calls for ongoing research, innovation, and openness to integrating knowledge from related disciplines. Despite the uncertainty, Clara's courage and the support of the clinic's multidisciplinary team fueled my determination to pursue answers. The complexity of her symptoms transformed the diagnostic process into a shared endeavor, a quest not only for diagnosis but for understanding and relief. As I prepared to engage specialists and explore new diagnostic territories, I was mindful of the delicate balance between clinical investigation and compassionate care. Clara's experience was a powerful reminder that the patient's voice is central, guiding the search for answers amid ambiguity. This phase of the journey was not just about tests and results. It was about resilience, trust, and the commitment to walk with a patient through the unknown. Clara's case challenged me to expand my horizons, embrace uncertainty, and reaffirm the core values of medicine and dentistry alike. The path ahead was uncertain, yet filled with the promise of discovery and healing. Together, we would navigate the complexities, driven by the hope that each new step would bring clarity to the smile that had become both a mystery and a mission. As Clara Evans's symptoms persisted without a clear diagnosis, it became increasingly apparent that her case required more than the tools and expertise available within the confines of our dental clinic. Recognizing the complexity of her presentation, I reached out to a network of specialists whose insights might illuminate the underlying causes of her intermittent pain and the perplexing changes in her smile. This collaborative effort marked a pivotal shift in Clara's diagnostic journey, transforming it from a solitary pursuit into a multidisciplinary investigation. The first consultations involved oral pathologists, experts trained to identify diseases affecting the mouth's tissues beyond what standard dental examinations reveal. I shared with them Clara's clinical history, symptom diary, and all imaging results collected thus far. Their evaluations included detailed oral mucosal assessments and biopsies of soft tissue areas that, upon closer inspection, showed subtle irregularities not immediately apparent during initial examinations. Although the biopsies returned negative for malignancies or common oral pathologies, these specialists provided invaluable perspectives on potential underlying inflammatory or autoimmune processes that could manifest with such elusive symptoms. Simultaneously, I coordinated with orthodontists to examine the possibility that subtle malocclusions or neuromuscular imbalances might contribute to Clara's smile alterations. Orthodontic assessment involved dynamic analysis of her bite and muscle coordination during various facial movements. While no significant occlusal discrepancies were identified, these evaluations helped rule out mechanical causes and underscored the functional complexity of the orofacial musculature. This input was crucial in narrowing down the potential sources of Clara's symptoms. Given the intermittent nature of Clara's pain and facial changes, I also sought the expertise of neurologists specializing in craniofacial disorders. Their involvement opened new avenues of inquiry into nerve function and central nervous system contributions to her symptoms. Neurological evaluations included nerve conduction studies, electromyography, and advanced imaging such as magnetic resonance neurography to visualize peripheral nerves. These assessments aimed to detect subtle neuropathies or demyelinating conditions that might evade detection by standard tests. Although no definitive neurological pathology was uncovered, the neurologists raised important considerations about functional neurological disorders and the interplay between nervous system regulation and facial musculature. Throughout these consultations, the diagnostic process expanded to include comprehensive testing for systemic autoimmune diseases. Blood panels were ordered to screen for markers associated with conditions such as lupus, Sjogren's syndrome, and other connective tissue diseases that can affect oral tissues and nerve function. These tests returned within normal limits, yet their inclusion was vital to exclude potential systemic contributors. The breadth of this investigative approach reflected the necessity of casting a wide net when confronting multifaceted symptoms. Amid these extensive evaluations, Clara's resilience and trust remained a cornerstone of the investigative process. She participated willingly in numerous tests and consultations, often traveling between specialists and enduring the frustrations of inconclusive results. Her commitment to seeking answers fueled my own determination and reinforced the importance of patient-centered care in navigating complex medical journeys. The collaborative nature of this phase fostered ongoing communication among the diverse specialists involved. Regular interdisciplinary meetings allowed us to share findings, discuss hypotheses, and coordinate next steps. These dialogues enriched the diagnostic process, blending dental, medical, and neurological perspectives into a more holistic understanding of Clara's condition. Such teamwork exemplified the evolving model of healthcare where boundaries between specialties blur in service of comprehensive patient care. As the investigations continued, we remained mindful of the psychosocial impact of Clara's symptoms. Chronic, unexplained pain and fluctuating facial appearance can exact a heavy emotional toll, affecting mental health and quality of life. To address this, I facilitated Clara's access to psychological support services specializing in chronic illness and pain management. Counseling sessions provided her with coping strategies and emotional resilience, complementing the medical and dental interventions underway. The complexity of Clara's case also highlighted the limitations of current diagnostic modalities when faced with subtle or functional disorders. Despite the array of advanced tests and specialist evaluations, many questions remained unanswered. This uncertainty underscored the need for ongoing research and innovation in understanding the nuanced interactions between oral structures, nerves, and systemic health. Throughout this process, Clara's active participation was a testament to the human spirit's capacity to endure and hope amidst ambiguity. Her willingness to engage with a multidisciplinary team, to share her experience candidly, and to persevere through diagnostic challenges exemplified the patient's vital role in the healthcare journey. This partnership deepened my appreciation for the collaborative nature of medicine and dentistry. Reflecting on these months of intensive investigation, I recognized the profound impact this case had on my professional perspective. Clara's symptoms, elusive yet persistent, challenged me to transcend traditional disciplinary boundaries and embrace a more integrated approach to patient care. It became clear that complex cases demand not only technical expertise but also humility, curiosity, and a commitment to lifelong learning. The collaborative efforts also fostered a culture of empathy and shared responsibility among the healthcare professionals involved. Each specialist brought unique insights and skills, yet all were united by a common goal: to alleviate Clara's suffering and restore her quality of life. This collective dedication served as a powerful reminder of the strength found in teamwork and open communication. In parallel with the clinical investigations, I continued to provide Clara with attentive dental care, ensuring that routine oral health needs were managed and that she felt supported throughout the process. Maintaining this continuity of care was essential in preserving trust and providing a stable foundation amid the uncertainties. As new information emerged from specialist consultations and advanced testing, we periodically reassessed our diagnostic hypotheses and management plans. This iterative process required flexibility and adaptability, as well as ongoing engagement with Clara to align clinical decisions with her evolving experience and preferences. Clara's case also sparked discussions within our clinic and professional circles about the challenges of diagnosing and managing atypical or unexplained oral symptoms. It highlighted the need for increased awareness, enhanced diagnostic tools, and multidisciplinary collaboration in addressing such cases. These conversations contributed to a growing recognition of the complexities inherent in dental and craniofacial medicine. Throughout this journey, I was continually reminded that behind every perplexing presentation lies a person seeking not just answers, but understanding and compassion. Clara's trust in our collaborative efforts was both humbling and inspiring, reinforcing the core principles of patient-centered care. This phase of the diagnostic exploration was marked by persistent inquiry, shared expertise, and unwavering commitment. While definitive answers remained elusive, the collective efforts forged a path forward, one grounded in hope, respect, and the relentless pursuit of knowledge. As I prepared to support Clara through the next stages of her care, I remained mindful of the lessons learned, that medicine and dentistry are as much about relationships as they are about science, that uncertainty requires patience and empathy, and that the journey toward healing often involves navigating the unknown together. Clara's smile, still a mystery in many ways, had become a catalyst for growth, collaboration, and renewed dedication to the art and science of healing. In the quiet moments between consultations and tests, I found myself reflecting deeply on the limits of dental science as I grappled with Clara Evans's puzzling condition. Despite the array of diagnostic tools and specialist input, her symptoms, sharp, intermittent pain paired with unpredictable changes in her smile, remained elusive, defying the conventional frameworks I had relied upon throughout my career. This realization was both humbling and profoundly unsettling, compelling me to reconsider not only the case at hand but the broader contours of what we understand about oral health. Dentistry, as I have always practiced and taught, is grounded in the tangible. Teeth that can be examined visually and radiographically, gums whose health can be measured and treated, and jaws whose function can be assessed mechanically. Yet Clara's case revealed that beneath these visible and measurable structures lies a complex, dynamic system where function and emotion intertwine, where the boundaries between physiology and psychology blur. It was a stark reminder that the smile is more than a sum of its parts. It is a living expression, an intricate dance of muscles, nerves, and tissues shaped by both biology and experience. The smile occupies a unique space in human communication, simultaneously functional and profoundly emotional. It conveys joy, vulnerability, confidence, and connection. When this expression becomes unpredictable, as in Clara's case, the impact transcends physical pain. It touches on identity, self-esteem, and the fundamental human need to be seen and understood. This insight deepened my appreciation for the intangible aspects of dental care, urging me to approach each patient not merely as a collection of symptoms, but as a whole person whose experiences and emotions matter equally. This contemplation extended to the limitations inherent in our diagnostic methods. Technology has advanced remarkably, yet it often struggles to capture the nuances of functional disorders, intermittent symptoms, or subtle neuromuscular imbalances. Clara's fluctuating symptoms, occurring sporadically and without clear structural cause, highlighted the gaps in our ability to measure and interpret the lived experience of pain and altered expression. It became evident that some aspects of oral health elude quantification, residing instead in the realm of subjective experience. Such realizations prompted me to adopt a posture of humility, an acknowledgement that, despite years of training and experience, there remain mysteries within dentistry that resist easy explanation. This humility did not signify defeat but rather an openness to learning, a willingness to question assumptions, and an acceptance that medicine is as much an art as it is a science. Clara's case became a mirror reflecting these truths, challenging me to expand my perspective and embrace uncertainty as an integral part of clinical practice. In parallel, I wrestled with the emotional dimensions of the case. Witnessing Clara's frustration and vulnerability as she navigated her symptoms without clear answers underscored the importance of empathy and communication. It reinforced that the therapeutic relationship is a cornerstone of effective care, especially when diagnostic certainty is lacking. Being present with patients in their uncertainty, validating their experiences, and offering support can be as healing as any procedure or prescription. This experience also led me to recognize the value of interdisciplinary collaboration not only as a clinical strategy but as a philosophical stance, one that acknowledges the complexity of human health and the need for diverse expertise to address it comprehensively. Clara's journey was a testament to the power of teamwork, where different lenses converge to create a fuller, richer understanding of a patient's condition. Moreover, I contemplated the broader implications of cases like Clara's for dental education and practice. They challenge us to cultivate flexibility in thinking, to foster curiosity beyond textbook knowledge, and to nurture skills in patient-centered communication. They remind us that every patient encounter is an opportunity to learn, to grow, and to refine our approach to care. As I reflected on these themes, I also considered how Clara's smile, an expression so central to human interaction, had become a symbol of the delicate balance between function and feeling. Her case illuminated the profound ways in which oral health intersects with identity and quality of life, urging me to advocate for a more holistic understanding of dentistry that integrates physical, emotional, and social dimensions. This awareness deepened my commitment to approaching dentistry with both scientific rigor and compassionate curiosity. It reminded me that beneath every clinical challenge lies a human story deserving of respect and empathy. Clara's resilience amid uncertainty inspired me to hold space for mystery, to remain patient in the search for answers, and to honor the complexity that defines both the human body and spirit. In contemplating the smile as both a functional act and an emotional language, I became attuned to the silent narratives embedded within Clara's expressions, the fear, hope, and courage that she carried even when words failed. This recognition transformed my understanding of the case from a mere clinical problem to a profound human experience. These reflections also prompted me to consider the ongoing evolution of dental science. Clara's case highlighted the need for continued research into the intersections of neurology, psychology, and oral health, as well as the development of diagnostic tools capable of capturing the subtle dynamics at play. It underscored the importance of integrating emerging knowledge from related fields to enrich our understanding and improve patient outcomes. Throughout this period of introspection, I remained dedicated to Clara's care, mindful that while the science was uncertain, the commitment to her well-being was unwavering. I sought to balance the pursuit of answers with attentive listening and compassionate presence, recognizing that healing encompasses more than physical resolution. In many ways, Clara's case became a catalyst for personal and professional growth. It challenged me to navigate the tension between confidence and doubt, knowledge and humility, certainty and ambiguity. It reaffirmed the essence of healthcare as a human endeavor marked by complexity, vulnerability, and hope. As I continued to accompany Clara on this journey, I carried with me these lessons that extended beyond the clinic walls into every patient interaction and clinical decision. Her smile, enigmatic yet powerful, served as a constant reminder of the profound connection between oral health and the human experience. This reflection deepened my resolve to embrace the mysteries inherent in medicine and dentistry, to honor the stories behind every symptom, and to approach each case with a blend of scientific inquiry and heartfelt empathy. Clara's journey was not just a challenge to be solved, but a call to engage more fully with the art and science of healing. In this space between knowledge and uncertainty, I found renewed purpose, a commitment to serve patients with humility, curiosity, and compassion, recognizing that the path to understanding is often as important as the destination itself. Clara's smile, fragile and fluctuating, had opened a window into the profound complexities of oral health and human resilience, shaping my practice in ways I had never anticipated. Several months into Clara Evans's diagnostic journey, a sudden escalation in her symptoms jolted us from a cautious equilibrium into a state of urgent reassessment. What had begun as intermittent episodes of sharp pain and subtle changes in her smile intensified unexpectedly, prompting an emergency evaluation that would prove pivotal in the unfolding of her case. Clara arrived at the clinic one afternoon, visibly distressed. She described a recent worsening of her symptoms. The sharp pains had become more frequent and severe, now accompanied by persistent facial muscle twitching and a pronounced asymmetry that left her visibly shaken. The changes in her smile, once fleeting and mild, had transformed into sustained distortions that affected her ability to speak and eat comfortably. This sudden deterioration raised immediate concerns and called for expedited diagnostic attention. Recognizing the urgency, I prioritized a comprehensive clinical reassessment. The physical examination revealed subtle but notable abnormalities in the soft tissues surrounding her jaw and lower face, areas that had appeared unremarkable in previous visits. There was mild swelling and tenderness in the masseter and buccinator muscles, and a faint, irregular texture to the mucosa inside her cheek. These findings suggested a localized process that might have developed or become more apparent with time. Given these new physical signs, I arranged for advanced imaging studies focused specifically on the soft tissues of the orofacial region. Magnetic resonance imaging (MRI) was employed to provide detailed visualization of muscles, nerves, and connective tissues. The MRI scans revealed subtle inflammatory changes and patchy areas of increased signal intensity within the muscles adjacent to her mandible. These findings had been undetectable on prior imaging modalities, highlighting the value of this more sensitive technique. The discovery of these previously unnoticed soft tissue abnormalities marked a critical turning point. They offered a tangible explanation for Clara's escalating symptoms and redirected our diagnostic focus toward inflammatory or possibly autoimmune processes affecting the orofacial musculature. This breakthrough underscored the importance of reevaluating patients thoroughly when clinical presentations evolve, and it reinforced the necessity of employing a range of diagnostic tools. In response to these findings, I collaborated closely with specialists in oral pathology and rheumatology to explore potential causes. Biopsies of the affected soft tissue areas were performed under local anesthesia, aiming to identify microscopic evidence of inflammation, fibrosis, or other pathological changes. The histopathological analysis revealed chronic inflammatory infiltrates consistent with a low-grade myositis, a rare condition characterized by inflammation of muscle fibers. This diagnosis, while providing clarity, also introduced new complexities. Myositis affecting the orofacial muscles is uncommon and often challenging to manage due to its insidious onset and variable progression. It can disrupt muscle function, leading to pain, weakness, and altered facial expressions, all symptoms that mirrored Clara's experience. Understanding this pathology offered a framework to explain the fluctuating nature of her symptoms and the progressive changes in her smile. The identification of myositis prompted initiation of targeted treatment strategies. We engaged rheumatologists to evaluate Clara's overall immune status and to consider immunomodulatory therapies that could mitigate inflammation and prevent further muscle damage. Corticosteroids and other immunosuppressive agents were contemplated, balancing their potential benefits against side effects. This marked a transition from purely diagnostic efforts to therapeutic intervention. Throughout this phase, Clara's resilience remained remarkable. Despite the distress of worsening symptoms and the uncertainty surrounding her diagnosis, she continued to engage actively in her care. Her trust in the multidisciplinary team and her determination to regain control over her health provided vital motivation for all involved. Her experience underscored the human dimension of medical care, the courage to face adversity, and the hope that sustains the journey toward healing. The emergence of soft tissue abnormalities also prompted a reassessment of prior diagnostic conclusions. It became evident that earlier imaging, though comprehensive, had limitations in detecting subtle muscular inflammation. This realization reinforced the need for vigilance and adaptability in clinical practice, especially when confronted with evolving symptomatology. It highlighted that diagnoses are not static but may require revision as new evidence emerges. Moreover, this turning point illuminated the intricate interplay between anatomy, pathology, and function within the orofacial region. The muscles responsible for facial expression and mastication are finely coordinated, and even minor disruptions can have profound clinical effects. Clara's case exemplified how inflammation within these muscles could manifest as both pain and altered appearance, complicating the clinical picture. As treatment commenced, we monitored Clara closely for response and potential side effects. Adjustments to her regimen were made based on symptom progression and laboratory markers. Physical therapy was incorporated to maintain muscle strength and function, aiming to preserve as much facial mobility as possible. The holistic approach recognized that managing myositis requires addressing both the underlying inflammation and its functional consequences. This period also brought into focus the emotional and psychological challenges Clara faced. The visible changes in her smile and the unpredictability of her symptoms affected her self-esteem and social interactions. Supportive counseling services played a crucial role in helping her navigate these difficulties, emphasizing the necessity of integrating mental health care into comprehensive treatment plans. Reflecting on this turning point, I was struck by the convergence of persistence, technology, and collaboration that led to the breakthrough. Clara's case had journeyed from a perplexing dental symptom to the identification of a rare inflammatory muscle disorder, illustrating the complexities inherent in diagnosing orofacial conditions. It was a testament to the value of reevaluation, multidisciplinary engagement, and patient partnership. This breakthrough also reinforced my conviction that effective care requires not only scientific knowledge but also an openness to revisiting assumptions and embracing uncertainty. Clara's evolving presentation demanded flexibility in thinking and a readiness to explore less common diagnoses, guided by emerging clinical evidence. As we moved forward, the focus shifted toward managing Clara's condition with a balance of optimism and realism. The diagnosis of orofacial myositis, while serious, offered a pathway to targeted treatment and potential symptom control. It transformed the mystery of her smile into a tangible clinical entity, enabling us to tailor interventions more precisely. Throughout this journey, Clara's smile, once a source of distress and confusion, became a symbol of resilience and hope. The discovery of soft tissue abnormalities was not just a diagnostic milestone but a moment of renewed possibility. It signaled that understanding was within reach, and that with concerted effort, improvement could follow. This phase also deepened my appreciation for the interconnectedness of disciplines in addressing complex health issues. The collaboration between dentistry, pathology, rheumatology, neurology, and psychology exemplified the comprehensive care necessary for such multifaceted cases. It highlighted how diverse expertise converges to illuminate the path forward. As Clara continued her treatment, I remained committed to supporting her through the uncertainties and challenges ahead. Her case had transformed my own practice, reminding me that beneath every symptom lies a story, and beneath every smile, a profound human experience deserving of care, compassion, and relentless inquiry. The turning point marked by the discovery of soft tissue abnormalities in Clara's jaw region was a defining moment, one that opened new avenues for diagnosis and treatment, and one that reaffirmed the enduring importance of perseverance, collaboration, and hope in the face of medical mystery. Following the discovery of subtle but significant soft tissue abnormalities around Clara Evans's jaw, our focus shifted into a phase marked by ongoing inquiry and cautious management. Despite the progress represented by this breakthrough, many questions about the precise nature and cause of her condition remained unanswered. This uncertainty propelled us into deeper exploration of rare dental and neurological syndromes that might account for Clara's persistent symptoms, driving a sustained commitment to research and interdisciplinary collaboration. The initial diagnosis of a low-grade myositis affecting orofacial muscles provided a tangible framework, yet the complexity of Clara's presentation suggested that this might be part of a broader or atypical syndrome. Given the rarity and variability of such conditions, we expanded our investigative scope to include a spectrum of uncommon disorders known to affect facial musculature and nerve function. This approach required integrating insights from specialties beyond dentistry, including neurology, immunology, and rheumatology. Advanced imaging techniques played a critical role in this ongoing evaluation. Building on the magnetic resonance imaging that had revealed inflammatory changes, we incorporated functional MRI and diffusion tensor imaging to assess nerve pathways and muscle activity in greater detail. These modalities offered dynamic views of tissue function, capturing subtle abnormalities that static images might miss. Although the results were nuanced and required careful interpretation, they contributed valuable data points that informed our evolving understanding. Parallel to imaging, we engaged in comprehensive genetic testing. Advances in genomics have illuminated numerous rare syndromes with craniofacial manifestations, some involving muscle inflammation or neuropathic pain. Whole exome sequencing was employed to search for mutations or variants that might correlate with Clara's symptoms. While no definitive genetic cause emerged, this line of inquiry underscored the potential for future discoveries and the importance of keeping abreast of developments in precision medicine. Throughout this process, the collaborative synergy between disciplines proved indispensable. Regular case conferences brought together dentists, neurologists, immunologists, radiologists, and geneticists to discuss findings, reassess hypotheses, and plan further investigations. This interdisciplinary dialogue fostered a holistic perspective, ensuring that no facet of Clara's condition was overlooked. It exemplified the evolving paradigm in healthcare where complex cases demand integrative approaches. Monitoring and managing Clara's symptoms required a dynamic balance between investigation and care. We implemented personalized management strategies, combining pharmacologic treatments aimed at modulating inflammation and neuropathic pain with supportive therapies, such as physical rehabilitation and psychological counseling. This comprehensive regimen sought to improve quality of life even as diagnostic clarity remained a work in progress. Advanced imaging and functional studies were repeated periodically to track disease progression and treatment response. These serial assessments provided critical feedback, guiding adjustments in therapy and highlighting areas requiring further attention. The integration of cutting-edge technology with clinical acumen illustrated the potential and the challenges of managing rare and complex conditions. Clara's engagement in this prolonged investigative and therapeutic process was remarkable. She maintained detailed symptom logs and actively participated in decision-making, embodying the role of a partner in her care. Her resilience and openness to novel interventions reinforced the human dimension of this scientific endeavor, reminding all involved that behind the data are lived experiences demanding empathy and respect. The broader implications of Clara's case extended beyond the individual. Her journey sparked conversations within our clinic and professional networks about the diagnostic challenges posed by unexplained orofacial symptoms. It highlighted gaps in current knowledge and the need for enhanced diagnostic criteria and tools. These discussions fostered a spirit of inquiry and innovation, encouraging practitioners to consider rare conditions and to collaborate across specialties more readily. The case also emphasized the importance of patient-centered care in the face of uncertainty. Clara's psychological well-being was closely monitored, with interventions to address anxiety and social isolation that often accompany chronic, unexplained symptoms. This holistic approach recognized that effective care encompasses not only physical health but also emotional and social dimensions. As research efforts continued, we remained vigilant for emerging studies and clinical trials that might offer new insights or therapeutic options. Clara's case became part of a broader narrative in dental and medical communities seeking to unravel the complexities of atypical orofacial disorders. Her experience underscored the value of registries and collaborative research networks in advancing understanding of rare conditions. Despite the absence of definitive answers, the ongoing inquiry was itself a source of hope. Each new test, each multidisciplinary discussion, and each therapeutic adjustment represented a step forward, a testament to the relentless pursuit of knowledge and the dedication to patient care that defines modern medicine and dentistry. Clara's case also served as a reminder of the evolving nature of healthcare. As technologies advance and our understanding deepens, conditions once deemed mysterious become clearer, enabling more precise diagnoses and effective treatments. This dynamic landscape calls for practitioners to remain lifelong learners, adaptable and curious in the face of complexity. The experience reinforced my own commitment to integrating emerging science with compassionate care. Clara's journey illustrated that managing rare and complicated cases requires not only technical skill but also patience, humility, and a willingness to embrace uncertainty alongside patients. As we continued to monitor and support Clara, I reflected on the profound lessons her case imparted. It illuminated the intricate interplay between dental structures, neurology, immunology, and psychology, an interplay that challenges traditional disciplinary boundaries and calls for integrated approaches. Her story became a catalyst for professional growth and a touchstone for the importance of collaboration in healthcare. It inspired ongoing efforts to improve diagnostic pathways and patient support systems for others facing similarly enigmatic conditions. Through it all, Clara's resilience and trust remained a beacon. Her willingness to confront uncertainty with grace and determination reinforced the human heart at the center of every clinical quest. The journey of inquiry and care continues, marked by advances, challenges, and the unwavering hope that each new discovery brings us closer to understanding and healing the smile that first brought Clara to our clinic. Clara Evans's case reverberated far beyond the walls of Greenfield Dental Clinic, sparking meaningful dialogue within the dental community about the challenges inherent in diagnosing and managing complex, unexplained oral symptoms. Her journey, marked by uncertainty and perseverance, became a catalyst for reflection among practitioners about the limitations of current diagnostic frameworks and the imperative of patient-centered care in navigating such complexities. Within professional circles, Clara's story was shared as a poignant example of a case that defied conventional categorization, prompting discussions at conferences, seminars, and journal clubs. Dentists, oral pathologists, and specialists from related fields grappled with the diagnostic ambiguities her symptoms presented, recognizing in her experience a broader pattern of patients whose complaints resist easy explanation. These conversations underscored the need for heightened awareness and sensitivity to atypical presentations, encouraging clinicians to maintain openness and avoid premature closure in their diagnostic reasoning. The case also highlighted gaps in existing educational curricula and clinical training. It became evident that preparing practitioners to handle such diagnostic conundrums requires fostering skills beyond technical proficiency, skills in critical thinking, interdisciplinary collaboration, and empathetic communication. Clara's journey inspired educators to integrate these competencies more explicitly into dental education, ensuring that future dentists are equipped to face the evolving complexities of oral health care. Moreover, Clara's experience underscored the vital importance of humility in clinical practice. Her case reminded practitioners that despite advances in technology and knowledge, uncertainty remains an intrinsic part of medicine and dentistry. Embracing this uncertainty with humility, rather than frustration or defensiveness, fosters a culture of continuous learning and better patient outcomes. Clara's story became a touchstone for this ethos, encouraging clinicians to acknowledge the limits of their understanding while striving for excellence. Beyond professional development, Clara's case reinforced the centrality of patient-centered care. Her journey illuminated how persistent symptoms, even when elusive to definitive diagnosis, profoundly impact patients' lives, physically, emotionally, and socially. The dental community was reminded that listening attentively, validating patient experiences, and collaborating transparently are essential components of compassionate care. Clara's trust and engagement throughout her diagnostic odyssey exemplified the therapeutic value of such an approach. Her case also invigorated efforts to strengthen interdisciplinary collaboration. Recognizing that complex oral symptoms often intersect with neurological, immunological, and psychological domains, dental practitioners increasingly sought partnerships with specialists outside traditional boundaries. Clara's story became an exemplar of how coordinated, multidisciplinary care can enhance diagnostic accuracy and patient support, prompting clinics and professional organizations to develop frameworks facilitating such collaboration. Within Greenfield Dental Clinic, Clara's case led to internal reflection and growth. The team embraced the lessons learned, enhancing protocols for managing complex cases and fostering a culture that values curiosity, resilience, and empathy. Staff training sessions incorporated discussions of her journey, emphasizing the importance of patience and comprehensive care. The clinic's commitment to innovation and collaboration was invigorated, setting a standard for addressing future diagnostic challenges. Clara's experience also resonated on a personal level for me as her primary dentist. It reshaped my approach to clinical practice, deepening my appreciation for the nuanced interplay between science and humanity in healthcare. Her case reinforced the imperative to remain curious and open-minded, to seek knowledge beyond immediate expertise, and to prioritize the patient's lived experience alongside objective findings. This transformation extended to my advocacy for systemic changes in dental practice. I became involved in initiatives promoting research into rare and complex oral conditions, supporting the development of advanced diagnostic tools, and championing multidisciplinary education. Clara's story fueled my dedication to advancing the field in ways that benefit patients facing similar mysteries. The broader dental community's response to Clara's journey also highlighted the importance of patient narratives in shaping healthcare. Sharing her story with permission, with sensitivity to her privacy, provided a human face to clinical challenges, fostering empathy among practitioners, and inspiring a collective commitment to improve care for patients with enigmatic symptoms. Her case contributed to the growing recognition that dentistry must evolve in tandem with medicine, embracing integrative approaches that consider the whole person. This perspective encourages practitioners to move beyond isolated symptom treatment toward holistic care that addresses physical, emotional, and social dimensions. In professional forums, Clara's case sparked dialogue about the ethical dimensions of care amidst uncertainty. Discussions centered on balancing the pursuit of diagnosis with the need to prevent patient distress from excessive testing or delayed treatment. Her experience informed guidelines emphasizing transparent communication, shared decision-making, and compassionate support throughout diagnostic processes. Clara's journey also reinforced the value of resilience, not only in patients but within healthcare providers. The challenges her case presented demanded sustained effort, adaptability, and emotional strength from all involved. Recognizing and nurturing these qualities became a focus in professional development programs inspired by her story. Through these ripples, Clara's case became more than an individual medical mystery. It evolved into a catalyst for cultural and professional transformation. Her experience illuminated the complexities inherent in oral healthcare and the profound impact thoughtful, patient-centered practice can have. As I continued to reflect on her journey, I remained grateful for the lessons imparted and motivated to carry forward the spirit of inquiry, empathy, and collaboration that defined her care. Clara's smile, once a source of uncertainty, now symbolizes the enduring commitment of the dental community to embrace complexity and to serve patients with unwavering dedication. Her story stands as a testament to the power of perseverance, the necessity of humility, and the transformative potential of compassionate care. Principles that continue to guide my practice and inspire the broader dental profession. The journey with Clara Evans has been one of the most profound experiences of my professional life. A case that continues to shape my approach to dentistry and patient care in ways I could never have anticipated. After months of investigation, collaboration, and careful management, Clara's condition has shown gradual improvement. While some questions remain unanswered, her symptoms have become more manageable, allowing her to regain a measure of normalcy and confidence in daily life. This progress, though cautious, is a testament to the resilience of the human body and spirit, as well as the power of comprehensive, patient-centered care. Clara's smile, once a source of distress and uncertainty, now reflects a quiet strength, a reminder of the journey we have traversed together. The fluctuations in her expression have lessened, the sharp pains have diminished, and her ability to engage socially has improved. These changes have brought relief not only to Clara but to all of us involved in her care. Throughout this ongoing process, my commitment to compassionate, attentive care has been renewed and deepened. Clara's case reinforced that effective treatment extends beyond clinical interventions. It requires listening, patience, and a partnership built on trust. Even when definitive diagnoses are elusive, the act of bearing witness to a patient's experience and responding with empathy can be profoundly healing. Interdisciplinary collaboration remains central to Clara's management. The continued involvement of specialists in neurology, immunology, oral pathology, and psychology ensures that her care addresses the multifaceted nature of her condition. Regular follow-ups and adaptive treatment plans reflect an understanding that chronic, complex conditions demand flexibility and vigilance. This experience has also strengthened my resolve to advocate for ongoing research into rare and unexplained oral conditions. Clara's journey highlighted the gaps in current knowledge and the need for innovative diagnostic tools and therapies. It has inspired me to contribute to professional initiatives aimed at advancing our understanding and improving patient outcomes. Moreover, Clara's case has deepened my appreciation for the emotional and social dimensions of oral health. The smile is not merely a functional movement but a profound expression of identity and connection. Protecting and restoring this expression touches on fundamental aspects of human dignity and well-being. This awareness shapes every patient interaction, reminding me to honor the whole person behind the clinical signs. As I reflect on the lessons learned, I recognize that Clara's case is emblematic of the evolving nature of dentistry itself, a discipline that must continually integrate scientific advances with holistic, empathetic care. It challenges us to embrace uncertainty, to remain curious, and to foster collaboration across specialties. It calls on us to see beyond the teeth and tissues to the stories and struggles that patients bring. Clara's smile, once enigmatic and fragile, now symbolizes the delicate balance between knowledge and mystery that defines medical practice. Her journey has illuminated the importance of compassion in the face of ambiguity and the resilience required to navigate complex health challenges. Her trust and courage have left an indelible mark on my practice, inspiring me to approach every patient with the same dedication and openness. In the years ahead, I carry forward the insights gained from Clara's story integrating them into my daily work and sharing them with colleagues and trainees. Her case serves as a reminder that every patient encounter is an opportunity to learn, to connect, and to contribute meaningfully to the art and science of healing. While some questions about Clara's condition remain, the progress achieved affirms that healing is often a journey rather than a destination. It requires patience, collaboration, and above all, a commitment to compassionate care that honors the whole person. Clara's smile, evolving and resilient, continues to inspire this commitment. Her story is a testament to the complexities and wonders of dentistry and medicine, a narrative of hope, perseverance, and the enduring human spirit. It reminds us that amidst the mysteries of health and disease, our role as practitioners is to walk alongside our patients, offering expertise, empathy, and unwavering support. As Clara continues her path forward, I remain dedicated to supporting her and others who face similar challenges, embracing the uncertainties with humility and compassion. Her journey has enriched my career and my understanding of what it means to care truly and deeply. In the end, Clara's smile, once a source of puzzlement, now stands as a symbol of growth, resilience, and the profound connection between patient and practitioner. It is a reminder that in the complex interplay of knowledge and uncertainty, compassion is the guiding light that leads us toward healing.